My background comes from medicine. I've been in private practice for about 40 years, and my practice has always been underserved area of San Diego. Now, over the years, I learned about the medical holy trinity: medicine, politics, and money. I learned that that's really what controls how effective the medical profession can be. You really need to develop alliances with your government, politics, foundations, coming together, trying to really solve the problems that I've always wanted to solve. That's what's excited me about getting involved in the Alliance Healthcare Foundation. Not only diverse ethnically, but diverse with ideas, to the point where I learned a lot. I always wanted to give back, not only my time, but economically. I call myself a social venture capitalist, meaning I believe in capitalism, but I also believe in equity. It's really all about the money, and many times what controls the money is the political aspect. Through my career, I've been involved in all three. Politically, I've been head of national organizations, testified before Congress, testified up in Sacramento. Financially, I started medical businesses. I think where the difficulty comes is equity doesn't mean equal. None of us are equal. There's nothing equal about me and my brothers and my sisters. Everybody is different. The issue is equity, and equity translates to justice and fairness. The Alliance Healthcare Foundation not only tried to focus on the mission, but implement it in what I felt was a just and equitable way. So that's one of the things that has impressed me. We need to focus based upon data. That's the only way you can really do equity. Identifying, addressing, and allocating resources according to the need rather than just allocating resources equally. I think data is important, but understanding and interpreting the data may be even more important. Ultimately, it's got to be impact. That's really where we're going. The issue is, how do you measure impact? Capacity building. Most foundations do not give any significant funding to capacity building. The Alliance has mission support and other capacity building for entities. Alliance Healthcare Foundation has developed a lot of positive capital in San Diego, Imperial County, because we've been there consistently funding small entities for capacity building. I think we got to figure out, how do we measure resilience, and how do we then feel comfortable taking a chance? For instance, when we do grants, I'm always looking for the outliers. There's an entity in town or a new alternative medicine that's producing clinicians that are not MDs. The more I learned about them, the more supportive I was. I actually got to travel to Cuba 2 or 3 times. And what was very impressive to me was how well their medical system worked and how they integrated alternative medicine into Western medicine. It allowed them to accomplish great things with few resources. I really think that that's where healthcare needs to go. We are in an excellent position. We've funded a lot of entities, have wonderful relationships, not only with other government, county, other foundations, and we can leverage the foundation's funding to get other entities to expand beyond what the foundation can do.